as an international movement. The question now is whether the American vote will lead to a split in the Anglican community.
Now, let's talk about this music in the operating theatre. Is it a distraction? I said, is it a distraction? You see, having to repeat yourself a bit like that was one of the things researchers found was happening when they filmed hours of operations in hospital theatres. The findings run counter to other studies, though, that suggest music can actually help surgeons stay calm and stay focused. Well, joining me here is the lead researcher of this recent study, Sharon from the Department of Surgery and Cancer at Imperial College London, and Dr. Hazim Sedidin, Specialist Registrar in Plastic and Reconstructive Surgery. Thanks to both of you. Welcome to the programme. Sharon, this research you've done, tell me a little more about what you actually found from all your cameras filming all of these operations.
Well, a lot of studies are looking at how music affects the individual, but we were looking at the team communication. And we first of all looked at the amount of repeated requests there were when music was playing compared to music not playing. And there was significantly more repeated requests, which we could see over time led to more frustrations. And even though the clinical staff might not have seen
What do you mean repeated requests?
So it could be for anything. So something as basic as, pass me the scissors, please. And the scrub nurse not hearing that, the surgeon had to ask again. And over the duration of an operation, this was quite frustrating.
And just briefly, before we come to the doctor, in those scenarios we were watching, who was making the decisions? Because clearly from the way you describe it, the doctors are issuing instructions, the nurses are struggling. Who is it?
Ei ole mahdollista.
That actually wants the music?
Well, in our study, it was probably 95% of the time the consultant leads surgeons, and sometimes the consultant anaesthetist.
Kai netti menisi just nyt.
And I suppose it underlines the hierarchy within the medical world as well. Now, doctor, I know that you have used music as you conduct surgery.
I really enjoy music, and I think in surgery it provides an ambience where surgeons can concentrate. Surgeons, we looked at the role of music in reducing anxiety levels in plastic surgery operations, minor surgeries, so both patients were awake. We found that music reduced anxiety levels as measured by the respiratory rate and by a validated anxiety scale. And there's lots in the literature to support that music does play a positive role. I think one key point that we found in our study was that we played it at a volume that was loud enough for the patient to hear, but definitely low enough that every single communication was key. And we actually...
Yeah, that's really interesting, because I just want to... drum and bass seems to crop up a lot in your report. I just want to play a little bit of the sort of thing that we are talking about. Let's just have a quick listen. We'll give Sharon a chance to cough, but that is what has thunders through some of the operating theatres. I mean, just very quickly, doctor, to you first of all, what do you play? Is that the sort of thing that you find relaxing, that helps you?
We play classical music, maybe popular music. Chart classics is what we publish, and easy listening music. But I personally don't listen to that. Some people may like that.
I mean, that's incredibly loud when you hear it like that. That's the sort of thing that you were filming and seeing. That is what the doctors are actually having as the backdrop to their operation.
Well, there's two camps, really. Some surgeons don't like to listen to any music at all, and those who do, it is intensely personal. So we did have classical, but we also had dance, drum and bass, rock. It was a very eclectic mix.
I mean, it's interesting what you were saying about patients who are conscious, that they too find it relaxing, because I suspect most patients, we were having this conversation upstairs, most patients are blissfully unaware. They would anticipate that when their operation was going on, every single person in that operating theatre would be 100% focused, no outside influences at all. I mean, they would be surprised, would they?
True. Now, I think the role of music is that it can act as a distraction to patients, in that there's other sounds going on. So there's several studies looking at this. So one study looked at certain words, such as can I have the scalpel, or is a patient oozing blood, and patients don't necessarily want to hear those things, and so music can be a distraction, but a slight distraction for the patients, so as not to interfere with the communication going on in theatres.
Let me ask you, if the operation isn't going perhaps smoothly, or something dramatic happens, at that stage, does the music get turned off, or does it just continue?
Oh, sure. It's a team effort, and of course, if anything is worrying, then easily the decision can be made that the music stops immediately and people concentrate more. And that is a rare instance, but it has to be acknowledged that our priority is patient safety and ensuring the operation runs smoothly and appropriately. And we don't play music all the time. Some patients don't want music. We take of course, it's the patient priority, and if they do not want music, we will not play music. And if the team does not want music, we won't play music. It's really, it's what you do in a team.
Well, we've run out of time, but Dr. Sharon, thanks to both of you. Just before we break, I will return to our main news at rescue operation in the Mediterranean. We're getting some latest figures. UNHCR in Italy say so far 250 migrants have been rescued, 16 bodies have been recovered, and 600 people were actually believed to be on board that fishing boat.